Hi everyone, this is Dr. Stefan. In this video I'd like to show you how to use a peak flow meter, which is this device. And many patients who have asthma or sometimes other respiratory conditions may be given one of these by their doctor, by their asthma nurse, or they may purchase one over the internet or from somewhere else. Basically, these devices are fairly simple. They just measure the peak flow that comes out of your lungs. So basically, when you're using one of these, you want to make sure that your chest is open. You're not slumped, you're not slouching, you're not in this position, because obviously the flow won't be as strong. The next thing would be, you need to look at this indicator on the right-hand side. So mine has, for example, goes from 0 or 60 to 800. So anyway, I would just pull this little arrow. I'm not sure if you can see it. I'll just pull it all the way down. And that's when I'm ready to use it. So, like I said, basically the easiest way is to do it sitting up, straight, with your chest open and loose. And then when you blow out, you're trying to blow as fast and as hard as you can. You don't have to do a full blowout. You just have to go fast and strong. So you generate the maximum flow. And that's what we'll measure. So I'm going to do that right now. And I'll take a deep breath in, and then I'll do it, right? So I have a lot of air to move. So deep breath in. And that's it, something like that. So generally I would suggest that you do 3 of them and you average the numbers out to get sort of what you should be getting. So this one I got 500 and a bit. I'm going to do another one. I'm going to just do it sharper this time if I can. So I'm going to try that. So that was actually less. It was just under 500. And I'm going to do a third one. This one, I'm going to try and aim to blow as sharp as I can. So, like I said, just blow hard and fast. You don't have to exhale all the way as if you're doing a spirometry. This one was just above 500. So I would say that the average is probably around there, around 500. Normally, every person has a different average. So normally they have a baseline value that depends on how big you are, how tall you are, what's your age, if you're a male or a female. So these things can matter, but generally you would base the abnormal values based on your personal average when you are feeling well. So I hope that was helpful. Don't forget to zero it once you finish. So you pull the arrow down before you do another blow. I hope this was helpful, and I'll see you in future videos. All the best.